Thanks a lot. So we were, Shannon and I hadn't quite figured out, we're really happy to be co-hosting, and Shannon's already set the scene for this Watersheds and Health conversation, which is a nice way for us to carry on the conversation. And what we thought we needed to do is I needed to introduce myself a little bit, and then Shannon's got some framing slides that we'll walk through, which will be a really helpful reminder of these issues. And I've got some other slides prepped in terms of the themes that might fuel our discussion along the way. So Shannon, are you okay if I just do a wee introduction and then we come back to you and your slides? Does that work out?
Yep.
Great. So I'm going to be doing we'll see if we'll do the test here around sharing screens, and hopefully you're able to, all going well, hopefully you're able to see a slide which is an introduction to me. So can you see that, folks? That's working all right?
Yeah, it's great.
Great. So importantly, my name is Margot Parkes, and these are images not of Vancouver Island, but of my territory where I come from. So I'm acknowledging, as many of you know me, but some people don't, my original home place is in Aotearoa, New Zealand, in Ngāi Tahu territory. And I've given the topic of today, it feels always very resonant to introduce myself in relation to the lands that I'm from, Te Wai Pounamu, which means the land of Pounamu, or the greenstone, the jade. The mountain, Maungatua, is the mountain that I orient to in this particular place, which is also in relation to the river. The river that you see here in the scroll plains in the top left are parts of the Tairi River, which comes down through multiple alluvial floodplains through the gorge that you can see in the top right, and comes out to the Pacific Ocean. And so Māori introduce themselves through whakapapa in a way that does connect them. Sometimes my colleagues refer to it as a GIS system, where you're orienting yourself to place through how you introduce yourself. So these are really important for me. This is the place where my Watersheds and Health journey began, and has continued and through my own origins, both growing up in this place, going to medical school, informed by this place, returning after many years away to do my PhD, learning about river catchments, watersheds, and health and wellbeing on the social and environmental determinants of health. And then through, in the bottom right of the screen, that squiggly line across Oceania, via Hawaii, I've been really fortunate to land and live and work on Lheidli T'enneh territory, Lheidli T'enneh being the people of the two rivers, the confluence of the Fraser and the Nechako in Prince George, which has been an enormous teacher to me, both that confluence, that bringing together of things, but also particularly the Nechako River, which is one of the rivers that flows into the Fraser. And many people don't know its name. Many of you know the Fraser River, but you don't know so much about the Nechako, because when one river flows into another river, it loses its name. And this is the longest and the most complex river retains the name. So the Nechako has been my teacher, a slightly silenced river, even though it's so profoundly important to the 14 First Nations who live in the Nechako. And I, in this place, have also been taught by lakes in these spaces. So it's important for this theme today that we're bringing forward our own personal experiences, not only of water, but of water in relation to land. And as you saw in the abstract for this session, that watersheds are characterized by this convergence and confluence where nature, society, and health can be understood as a whole. And Shannon already gave us a taste of that. So that's an introduction to me and some of the themes we're wanting to draw out around the things that are coming together and an integrative approach to watersheds. The final slide here is just to recognise that these are, from an Indigenous perspective, they're really important ideas of whether it's kia te kutai, from the mountains to the sea, ahupua'a, catchments, watersheds, that these are consistent ways and places and settings that for millennia Indigenous peoples have acknowledged as a way to understand what brings us life and health, and understanding living systems as a source of both the social and ecological determinants of health. So we've heard some of those themes today, and Shannon's presentation now is going to really land us particularly where her really important work has been unfolding. So I'll stop sharing my screen and we may come back to a couple of slides later. Thanks, Shannon. Over to you. Haven't stopped sharing yet, but I'm about to. Enough sharing from me. Stop sharing.
All right, and I'm now so like apprehensive. Can people hear me?
We can, Shannon. Yep.
Okay. So yeah. So thanks, Margot, and yeah, it's been a real pleasure for me to get to know Margot more over the past few weeks, really. And I'm just going to share a few slides with you guys around some of the things I've been thinking about and working around with regards to watersheds and health, and really something that I spoke to really briefly earlier today, the opportunity I think we really have with the Dripa Act here in BC.
Yes, indeed.
So yeah, really what I'm just going to be sharing with you about here for a few minutes is work that I've really come into doing with my amazing colleague, Dr. Danielle Bain-Smith, who some of you may know. She's Echo-Dene and Métis, and she's the Aboriginal Health Physician Advisor with the Provincial Health Officer, who now is a much more better known individual, Dr. Bonnie Henry. And what we're really looking at is how do we reconcile some of our public health legislation, and specifically here, we were looking at the Drinking Water Protection Act, and I think how we're looking at the Drinking Water Protection Act really brings it beyond drinking water to looking at watersheds, which is why I thought I'd share a little bit with you here this morning about it. So in a lot of our work in and around this area, Danielle and I use and speak to the concept of acknowledgement, two-eyed seeing quite a bit, and I just want to acknowledge that Mi'kmaq Elder Albert Marshall was the individual who coined the term acknowledgement. And in that vein, some of the slides I'll just share with you here depict some of that two-eyed seeing. So here, just some of the perspectives on water as relates to population health and well-being. On the left-hand side is an Indigenous depiction. So this is beautiful art by Michif artist Christy Belcourt, and saying, you know, water is life. We have a duty, responsibility to protect water. You can see here things are very interconnected. Animals, medicines are considered there. Water is spiritual, sacred. It's a relative, and you know, certainly not a commodity. And on the right-hand side is, you know, one depiction of somewhat of a Western view of water. The view here, I think, often is much more discreet, and so, you know, that the drop of water in the middle, I think, you know, is a very discreet thing. And I'll also acknowledge that water perhaps isn't very much depicted in the picture on the left, but as a discrete being. But in all those beings and depicted in the picture, water is very integral to the bodies in every part of what's in that picture. So yeah, so it's a bit more of a discrete approach. It's often very much thought of in terms of its utility to humans. And so it's written legislation versus sacred laws. And in yellow there is mentioned the Drinking Water Protection Act, which is something I know intimately through being a medical health officer, and that looks at the areas of source water protection, water treatment, and storage and distribution. And right now, you know, there's a lot going on with water governance in BC, and also a lot going on with Indigenous rights. On the left here is a report that came out from the Office of the Auditor General last year around the protection of drinking water. This report referenced, you know, we had an action plan for safe drinking water in the province that came out in 2002 that stated we needed to have effective legislation and clear responsibilities within government. Water spans multiple stakeholders here in this province: forest lands, natural resource health. And the provincial health officer, so Bonnie Henry, who Daniel works with, holds specific accountability under the Drinking Water Protection Act. And this report actually was fairly critical of the Ministry of Health, saying they weren't taking leadership in protecting drinking water, and that the provincial health officer and the Ministry of Health really needed to take a look at roles and responsibilities. And it also stated that the Drinking Water Protection Act actually didn't really support the Ministry of Health or the provincial health officer to protect water in the best way. There's something within the Drinking Water Protection Act called a water protection plan that the provincial health officer can ask for. That has actually been recommended 4 times in this province, but has never been ordered by the health minister. So there's a review of that fact. And so ultimately, in the end, what was asked is there be a review of the legislations and regulations that affect drinking water. So a very interesting place for us to be as a province at the same time that the Declaration on the Rights of Indigenous Peoples Act came forward in November of 2019. So just months after this report from the OAG came out, we have now got within law here in BC that we have to align our legislation with Andrip, so that our rights to maintain our relationships with water as Indigenous peoples now have to be part of law. What an exciting time to be looking at water legislation in this province. And so there's a lot of tensions that exist when you're looking at, with two-eyed seeing. And so Daniel and I have been exploring some existing Indigenous frameworks that can help to reconcile some of these epistemological tensions. One here on the left is what's called the Population Health and Wellness Agenda that the First Nations Health Authority and the Provincial Health Officer's Office, Danielle, amongst them, have helped to put together. It really looks at, what are the determinants of health. So that's more seeing the health outcomes. At the top are people out on the land being healthy, self-determining, and vibrant. And so we really want to help support the determinants, which include family, land, community, nations, water being part of that. And then on the left, or on the right, you can see another framework being used. Maya mentioned as well in her opening, is the rights of nature movements that have been in place around the world. Maya mentioned Ecuador and Bolivia. There have been a number of things in the US amongst the White Earth band of the Ojibwe with recognizing rights of Manuman or rice in their territory, which in 2019 granting rights to the Klamath River. And then with Margot on this call, Aotearoa has done, the Maori have done a lot of work in Aotearoa, New Zealand, around the Te Aroera Act, which it granted rights to a forest park, and the Te Awa Tapoia Act, which granted rights to the Bangadui River. So we have a lot of local and international examples of how we can try and, protect our relationship and responsibilities to waters as Indigenous people when we're looking at legislation. So ultimately, what we're proposing in moving in a path forward, Danielle and I, is that when we're doing the Drinking Water Protection Act legislative review, that we hold that Dripa Act and the rights of Indigenous peoples in our relationships to water, and that ability to really help support source water protection, protecting our watersheds, our river catchments in a way that has never been enabled before with the legislation that already exists. It is an opportunity and something that we're both dedicated to working forward on. And so if this legislation is going to incorporate an indigenous perspective, it has to change. And some of that change might, I think, is going to have to be as fundamental as no longer being called the Drinking Water Protection Act, because that makes it anthropocentric. It's only about water and its utility to humans, and it can never protect that relationship we have with water as a living being in its current form. And we have examples here, just a couple in closing out, just giving some context perhaps for a discussion that we might have, is there's work. I sit at the Cowichan Watershed Board. There's examples that we've put forward in ways to build reconciliation in management of our watershed. And then also last year, there was a Clapham plan with the Tahltan government and the BC government, which had joint recommendations for the area that encompasses the Tahltan Sacred Headwaters. I will state, though, both these examples, the Clap Pan is not a legal instrument, and the Cowichan Watershed Board does not have statutory decision-making powers. So while we can build on these examples, and I think it's great work, I think it's time that, you know, within our legislation, adapts more of a two-eyed seeing view, and that's ultimately what we need to protect our watersheds and our own health. So yeah, and I'll just close with this quote from the Dripa Act report that I shared with you in the previous slide. I thought it was pretty powerful. My grandfather, a Gitxsan High Chief Lout, said to me in the 80s, "You watch, one day our Gitxsan way of life, our traditional laws in Alaxiap will be enshrined in the white man's laws. It will be a small, faint light, then it will begin to glow, and then it will glitter in their supreme law. With BC legislating the UN Declaration, it will signal and provide opportunities for meaningful coexistence, true redress to be recognized as corporate holders, partnerships on the Alaxiap to jointly manage, plan, and share the economic fruits." So yeah, thanks. And just a few thoughts to maybe, you know, ground the conversation we'll have moving forward.
Mm. Oh, Shannon, that's great. That quote gave me a nice little shiver down my spine, because there is a real sense of the moment with the Dripa Act coming into force, and this some really foundational shifts in how public health can be part of complex solutions with others to progress this important work. And the plan, as you heard for this session today, is to be discussing and just having a conversation about this particular topic area, but also to remind people that we've got this, where we're heading with the notes. And thanks again to Kathy, who's going to take notes, and we're going to migrate at some point to share the screen and put up the notes that we're taking, and we'll be trying to zoom in on a couple of key points to bring back to the main room. So good luck to us, because I think there'll be far-reaching discussion. I think we're probably a small enough group to, if you have the appetite for it, to turn on your camera, so we can kind of imagine sitting around the room together. Obviously, if that's not the best for you, that's fine. But I really appreciate that you've all chosen to be part of this conversation. And I think importantly, Shannon has set by the important work in the backdrop, this legislative shift, the powerful work that's been happening in the Cowichan, and I can speak. Shannon is the health representative on the Cowichan Watershed Board, is such a fascinating co-chaired entity. One of my roles, as well as being a prof in health sciences here at UNBC, is to be currently the co-chair of the Nechako Watershed Roundtable, which is another example of these kinds of complex, multi-stakeholder convening entities that are where public health needs to be part of the conversation, but previously has often been separate from, because public health has had a different sort of engagement with these kinds of considerations. So Shannon, thoughts on, should we just open up for queries and discussions? How shall we? We do have a slightly longer period of time in our breakout rooms. We've got, by my countdown up the top right, we have half an hour left, which is good. What are your thoughts, Shannon? We should just start off with discussion and people turning on their mics and having a chat.
Yeah, sounds good.
Should I start sharing the screen now with the Word document?
I think let's just have, if you're taking notes in the background for now, Kathy, let's just have a conversation with the group of us. When you share your screen, it means we don't get to see each other so easily.
True, that makes sense.
When we start zooming in on those key points, we'll probably come around to that in a few minutes. But you're taking notes for us in the background for now, aren't you?
Yeah, I can.
And we're keeping that theme of what are the key implications for public health action. You can also share things in the chat box. It's alive in this group as well, but we can talk to each other. So queries, thoughts, inspirations, curiosities.
Well, Vic Neufeld. Hi, everybody. I'll just jump in with a question, really. I work with colleagues in Western Zambia, where the Zambezi River runs right through the middle of that province, and there's a remarkably big watershed area. I guess my question listening to you folks was whether the United Nations, whether Andrip is known in, say, countries in Africa. In the group I work with are the indigenous people called the Lozi people. And to be honest, I haven't really thought about the application of Andrip to that watershed area as it might apply to the indigenous people there. And how would I go about finding out about that? So that's a question in my head.
So I'll hand over to Shannon if she has any thoughts here. But my experience, Vic, is that just as in Canada, Andrip has been a enabling mechanism for conversations. Until BC made it its own Dripa Act, it hasn't been particularly powerful. So it will depend on what the context of the particular country's engagement with something like Andrip is. It's there and being invoked by Indigenous organisations globally. I'm currently working on with Shannon and others on a large international collaboration around understanding the connections between climate, catchment and community, or watersheds and community. And in each of those different contexts, there are people starting to realise that Andrip can be an enabling mechanism, but it's not. I think that what we've just experienced with Dripa coming in is that the theoretical framing, and now I think it'd be really helpful, Shannon, to hear your sense, and you've just highlighted, we've moved through to a very different time because we now have this Dripa Act. And with that coming in, it's changed the conversation in terms of what public health's going to have to do. I don't know if you have any thoughts about the difference between a broad Andrip framing in a place and now the power of a piece of legislation in our BC context.
Yeah, I mean, I was going to say, Vic, I mean, I imagine you are already engaging with the Indigenous groups within the area that you're talking about, but I would start there, and I imagine some individuals there might be familiar with Andrip, and I think, as Margot had stated, I think it's one thing for Indigenous populations around the world to realize how many commonalities and similarities we have in our you know, aspirations for better health for ourselves and the lands that we live in. So I think Andrip is it provides some comfort in unification for different peoples around the planet, but also at the same time, we're in very different, while we have similar histories, we're also experiencing different current realities around the planet as well. So yeah, in terms of what its utility might be in being able to make real change in the area you're talking about depends on the local context. I mean, here in Canada, we didn't even recognize Andrip until 2016. Yeah. So it was something that was talked about. I talked about it as a public health physician, but it wasn't recognized until 2017. And now it's like Danielle and I can go to the people who are doing the water legislative review and be like, you know what, you need to do this. And that's going to be a very uncomfortable reality for the people who I think were hoping the legislative review might look a certain way or take a certain amount of time, because it's going to basically require to be dismantled and recreated. Yeah. But I ultimately hope that the impetus to do so is so strong, because the Officer of the Auditor General has also said, like, we we haven't protected water. We don't even know whose responsibility this is based on the system we currently have. So, yeah, I think, you know, talking with the local Indigenous community and you know, knowing where things are at within the local legislative constructs is two areas to maybe start with that.
Great, thanks. I shall certainly explore it. Thank you very much.
And I think what's being invoked here, I mean, it's sort of interesting to think outside of Canada because these issues are actually needed worldwide. And then we come into Canada, recognize that since 2016, Andrip has been creating some new conversations. And now we land in BC, where what Shannon just described is going to cascade through a lot of our public health, the work that public health engages in. And where I think it's very interesting for us as a group of colleagues, we don't know all of each other, and it would be really neat. The chat box does come in again to, well, we can use it for our own purposes. It doesn't come into the main room. But it'd be really helpful just for the purposes of this discussion if you could just type again where you're calling in from, so we have a sense of around BC and the various territories, and importantly, if you know it, which you may or may not, which watershed you're sitting in, which can actually be one of those interesting questions for people, that you're drinking that watershed, you are that watershed, but you may not actually know where your water comes from or what watershed you sit in. And sometimes your drinking water will come from a location that's outside of your actual watershed. So thanks, Dina. It's really nice to just imagine people populating across the country in different contexts. So it'll be nice to see that pop up. Other questions for us before we start thinking about we sort of migrate over?
I have some comments.
Go ahead.
Yeah, hi, Tansy. My name is Kishkinawa Tashkwe and Tatipue. My Western name is Stephanie. I'm a member of the Manitoba Métis Federation, a citizen of the Métis people, and I'm from the Red River floodplain. And I think it's really interesting that we want to talk about how we legislate water and how we co-manage water as Indigenous people with the Western system. But I often wonder how that also legitimizes ownership of something that I think is actually the root cause of what we're talking about a lot today. I think if you think back thousands of years ago, when everybody was probably Indigenous, ownership was something that was not even actually considered at all, and with ownership came greed. And I think that's led us to a lot of the problems that we have today, especially during, you know, the sixth mass extinction that we're currently facing, the great die-off of our species and our land and the other species we share it with, that seems to be very imminent. I'm more interested, instead of talking about, you know, how things like the Andrip and how various other inquests that we've had to increase health equity for Indigenous people, although it's well-meaning, inherently what it's actually also missing is the fact that we're already sovereign, and that we have rights to exercise over these lands. And I'd like to maybe shift the discussion a little bit to also consider places, and you're from New Zealand, or Aotearoa, sorry if I mispronounced that, where they're giving, you know, water and bodies of water human status and human rights, because I really think it's hard for people to shift. It's still, when we're discussing this, we're talking about humans owning or overseeing what happens to the water, and not looking from really an Indigenous way of knowing, which would be that the water in itself is already whole, it's already a sovereign being itself. And so as long as we're staying within that Western paradigm, I don't think we're going to necessarily be effective in terms of, you know, what are some public health strategies that can come from this. And so I just like to, you know, add that to the conversation today and see if there's any comments. Thank you.
Shannon, what are your thoughts about this, this sort of both the balance of trying to leverage where there is this window and also the pretty important fundamental questions that are being raised there about how we understand ownership and they're pretty profound kind of implications once we start thinking about land and water.
Yeah. Yeah. Thanks for that. Those comments, Stephanie, because that is, yeah, truly, you know, at the basis for the different viewpoints, perspectives, and it's a challenging one that I straddle as, you know, a Western trained physician who has, like, the irony hits me daily that, you know, I'm pushing Western legislation. I have a role to enforce the Public Health Act in my home territory. And so it's, you know, and sometimes I feel like this is not, well, why am I spending my time doing this? Like, because there's so much of my time that is spent on areas that I don't think is what should be focused on. And I mean, right now I'm determining that, you know, okay, I mean, for myself, I've, you know, had the privilege of going to medical school and being in this role. So I have to, you know, this seems like a great opportunity to really work within the shifts that have happened here in the province, which is still, by and large, within a Western paradigm. And so that's why I really see it as such an opportunity with Dr. Danielle Bain-Smith being at the Provincial Health Officer's office as well, that, you know, we're both in Western institutions, but, you know, her and I being able to bring that perspective and, you know, also speak about the times we have to bang our heads against a wall about, you know, things that just, you know, fundamental preconceptions about, you know, yeah, that we don't own water. Water is not a commodity. It's sacred. And, you know, sometimes I'm like, you know, I'm well aware of the fact that, you know, trying to blow up the Drinking Water Protection Act might not make me very popular as a medical health officer, but that, you know, if I'm playing this role, trying to, you know, keep my job, that I'm not playing a service to my ancestors who came before me and the future generations to come. And one of my mentors said, you know, if you're not in danger of getting fired as a medical health officer, you're not doing your job. So I guess, you know, it kind of comes with the territory. But yeah, like, I just really appreciate you bringing that forward, because I think we need to do that for each other continuously, because I think we're within largely Western systems most days, you know, in our work. For a lot of us, so that we need to remind ourselves that, you know, that is not the orientation that we need to start from or make assumptions from. So yeah, I'm not sure if I've answered, but I don't think you were looking for an answer, just more asking for the conversation to, you know, be furthered. So those are some of my thoughts. Yeah.
Yeah. No, and you're doing a great job, and it's not a criticism about the work that you're doing. And it's just also to reframe some, and I know probably you're well aware of a lot of this, but there may be others that are joining us that maybe needed that framing. And so I just felt compelled to share my thoughts on that. So thank you.
We've had at the top, people might see a little warning that we've got a 15-minute warning. So that's a good cue for us that we've got, but it seems like a treat to have this opportunity to have 15 more minutes to talk about this important issue. And yeah, Stephanie, I think this question, one of the things that I have observed over the years I've had the good fortune to live and work and be thinking about this watersheds or catchments or ahupua'a if I'm in Hawaii, work in the context of Aotearoa, in the context of Hawaii, in the context of Ecuador with Indigenous leadership in those spaces there, and now to be working here on unceded Kailai Tēnei territory. that this idea that in the health context and it's just something I'm still learning so much about, that there has been an increased recognition to acknowledge land as part of public health conversations, to acknowledge territory. But in so many conversations, and I've had many discussions with my colleagues in the past who work in Indigenous health, that the land then leaves the room somehow. And one of the reasons it leaves the room is because it's actually painful to keep it in the room. And that there has been so much loss associated with these conversations around land and water and people's beings, their ancestors, that to kind of hold all of that in the room verbally, to sort of keep landing it. So quite often in the health conversations, I'll be there's a land acknowledgement, there's a acknowledgement of this basis, and then we sort of, because public health has a lot of other challenging issues to deal with, we switch gears and we lose that grounding, and we might come back to it at the end. And what I'm hearing, and I think Shannon and Danielle and others in their roles are bringing, such an important grounding as public health physicians and those that are shifting that conversation. And with the images and the First Nations Health Authority and the interweaving and the integration, to deeply challenge this idea that we have to flip-flop. It's hard work, and but it's incredibly important work. And I'm so excited about the fact that with Dripa, we've got, I think, new opportunities. But and this is the sort of shift in our conversation now, we as public health people, who for many, I've sat at multiple public health events where I've had people coming up to me with tears in their eyes saying, I didn't think I could talk about land and water because I'm not an environmental health person. That somehow the public health community has created this false dichotomy between the ecological and the social. And I'm an equity champion. I don't have time to think about environmental issues as well. And Maya has done so much this morning to remind us that that's a totally absurd dichotomy. So again, the leveraging off where Shannon has left us, we're in this very interesting moment now. What do you guys feel excited about or inspired about how public health can be part of these new conversations? It's a very challenging, exciting, confronting space. What do people think?
I actually love this. I feel like it's going to give us some, some kind of, I don't even know the word I'm looking for right now, but I have spent my whole public health career writing different briefs when different projects are proposed saying, we can't do this, it's bad for public health, it's bad for environmental health, it's bad for social justice, and having those disregarded, saying, oh, that's not our mandate. And I forward them to my managers and my supervisors and to the environmental health team. And I mean, listening to this today is like, now I have something with some authority to back up some of that, and maybe it will change.
Yeah, and that's not my mandate dilemma. It's that sort of in the box public health thinking in terms of where the legislative mandates fit, and then the integrative full vision of a more eco-social kind of fulsome vision of public health that so many people would like to do, but get told operationally they're not allowed to do. And
right.
Shannon, I'm really curious. I want to underscore the treat of getting to know Danielle recently and yourself, in terms of this important work. Where this sits operationally in the public health community is something that can be quite confusing for people, because we know that environmental health practice has a very particular framing. It's got a really important legacy. It does incredibly important work. But for so many environmental health technicians and others that are working in that space, this big picture, integrative, non-linear, holistic thinking is not what people's training is. And so we've got people that are trained in environmental public health with extremely important skills, but that are being leapt into this more integrative space. And I'm curious, Shannon, where you see that, where this fits operationally in public health is such an interesting question to me. And working with our public health colleagues, we're in active conversations in Northern BC where some of this work, this complex work, is sitting in the Office of Health and Resource Development, because that's the group that can do it. So it looks like you've got a thought there, Karen, and then I'm really curious of Shannon's thoughts.
Yeah, sorry about that. I just want to clarify, the public health offices themselves are right on board. It's always higher up that says no. They say they're doing the same thing I am, asking to be able to step in to some of these decisions and policies being made. Sorry, go ahead, Shannon, or Margot.
Yeah, I've come across that as well, Karen, and I guess my thoughts around where should this be, these conversations be happening, is everywhere. So I have a very generalist role as a medical health officer. I have been very busy since COVID. I have a portfolio, I have a geographic area, so I have my home territory that I work to support health in. I sit on different committees around water, like the Drinking Water Leadership Council table. And I think a bit of what Margot was getting to around like environmental health has typically, I think, been seen as very technical. So like, you know, if there's a medical health officer or public health physician expertise sitting around the table at, say, Drinking Water Leadership Council, sometimes that person is looked to help interpret the latest manganese guideline or the latest, like, you know, chlorine water treatment. And like, I have to know all that stuff, but that is so far down in the details that what I in fact try and do is you know, ask when the Drinking Water Protection Act legislative review comes up, like, oh, how are Indigenous peoples being involved, not consulted, but involved? So I think it's all the places and all the spaces we can have that, those types of conversations. But I think also a bit of what you might have been getting to at the end of what you're saying, Karen, is that we can have those conversations, but there's also a decision-making place where people say yay or nay, or yes, this goes forward, or no, it doesn't. And that's where we've got to be part of and able to influence, be decision makers. And when we have legislation which sets the final bar, like we can do all kinds of work, like the Cowichan Watershed Board work and the Clapham Plan are wonderful pieces of work. But if a decision maker says, oh yeah, that's great, but it doesn't have any decision-making authority, then it's really limited in the scope of what it can do. So I think everywhere, and especially at the decision-making tables.
Yeah.
So we've got about 5 minutes left, and I'm going to ask Kathy to pull up our little PowerPoint that was going to come back into the room. And we've started, and I'd encourage you to use the chat box if you sort of feel like there's gem points that you want to see. Our task is to sort of refine 3 or 4 key points that we might feel could return from this conversation into the main room. And I think Shannon was just articulating some of those, that, you know, the idea that we have to be able to influence and be decision makers to reflect this more a holistic approach is sort of one of the kinds of ideas. So what Kathy's showing right now, just so that you're aware, is that she's been taking notes of the whole conversation. So our whole conversation will be there in the background, and that'll be something that we can continue with and refer to. And it's sort of part of what PHABC is also listening to through this institute. But I think, Kathy, maybe we'll pull up now that little dot point PowerPoint one, if you've got it there, as we hit our 5 minutes remaining. And we're deciding our main points and who will speak to them for the main feedback session. Do you have that little PowerPoint somewhere, Kathy?
Yeah, does it show the PowerPoint right now?
Yeah, you'll have to stop sharing and then reshare with that little document.
Okay, let me see.
And I wonder, Shannon, if you're comfortable, because I think it's such a great riff off where we were before. I don't know if you're okay to present these points back when we get to them, or if there's anybody else that would want to. I mean, I'm happy to pitch in at whatever point, but so I think this is sort of a time for just sort of sharing kind of gems of ideas in the chat box, or Kathy will try to capture them here. So 3 to 5 main points. We've already got one, that idea that I in the chat box that Shannon was just saying, we have to influence and be decision makers to reflect this more holistic approach in public health. I think I really like the idea that watersheds and health kind of is an idea that is beyond environmental health issues. It has to touch on all aspects of public health practice. I don't know if the wording we want to get there. I wonder if we could capture something that speaks to what you're just saying, Karen, about the way that you now feel empowered to bring these things forward. And what is it that's enabling you to feel empowered to have a mandate? Is it the Dripa Act? Is that what you were meaning there?
I like having things to refer to besides just my research and my understanding of things. It's like, this is a public health agency, and you guys as an authority are speaking to it, and the Act, the Drip and Andrip. You know, there's other references, so it's not just me, Karen Citizen, saying, you know, do this, do this. And I know we should be able to do that, and I do. I mean, I certainly keep doing it anyway, but it's just really nice to say there's a whole body of professionals behind this, and I really like that.
Yeah, that's great. And I think we might refine and tweak our little slides here. We'll definitely have 3 or 4 points, but I think there's something very powerful for PHABC in the idea of having Dripa. You could probably paste a version of that, Kathy, from the chat box, but having Dripa, meaning the Declaration on the Rights of Indigenous Peoples Act, creates a foundation for more integrative conversations in BC that I don't know how you might frame that, Shannon. I might not have got that idea right, but anyway, we're not wordsmithing now.
But it's great. Like, it's really good to have that. I really think it's valuable.
Yeah, so I'm really glad you mentioned that, Dina. This idea that health promotion, Trevor and I and others that have written about bringing a more eco-social approach to public health education and training, that somehow health promotion gets disconnected from its ecological roots so often. Yeah. So I think this idea that grounding health promotion in the living systems that we depend on is, I think, it's been said in the Ottawa Charter, it's got the social ecological approach there, but somehow we forget the ecological, we forget the land and water. People trip up over this word ecological, and they think of it as some kind of greeny thing, and they forget we're talking about the living systems that we depend on. And that loss, I think, is, again, watersheds and work. I mean, it's something I'm pretty passionate about, because that framing of watersheds as a setting for public health practice and health promotion, as compared to and embracing schools and hospitals and all these other settings we talk about, healthy communities nested within the living systems they depend on, is a powerful lift and gaze for public health. We're going to get chucked out. I think we've got a few points there, Shannon, we can riff off. What do you think?
Yeah. So what's happened? Are we just going to launch back into the big room? Is that what
we are? It's happening momentarily. We're back. It's we've got 56 seconds. So we will.
I think adding Stephanie's comment somewhere in there would be really nice too.
Yes, the important, yes, please, thanks for that. So if maybe you could add, Kathy, just the importance of challenging notions of ownership in relation to land and water as a framing for watersheds and health work, something along those lines would be really, you might have that, not seeing it popping up, but you're doing a great job, Kathy.
Can you see that right now? Yeah, like the 6 points?
That's good.
Okay.
Yeah, that's great. And I think you can remove the Dripa as a sub point. I think it's a point on its own, but that's great. And we'll be back in the room in 11 seconds. And then Shannon, you can make that font size a bit bigger. We'll be able to speak to this and riff off it. So